Hi, everybody. So I was just teaching my online client some work with side bends, and as she was doing it seated in the chair, I stood up and started doing it in my way, standing, which is a modified yoga triangle work combined with a little Lester Horton technique, laterals, strong laterals. Here's what I came up with, and I find it interesting that suddenly I can do a side bend towards the left side, opening up the right side better now after getting the left total hip replacement anterior approach surgery. And the reason for that is that where it felt like I was having a massive restriction on the right side before, the tension, the torque in my spine, I do have some scoliosis, but now I can hinge more over this left hip. Okay? This is something I couldn't do before. And in some ways I couldn't even tell that I couldn't do it. I knew this was part of the problem because I'm a structural integration manual therapist, blah blah blah. Here's the thing. Now I can hinge over this and I can get a real nice side lateral in this way that I do it. Yeah. And I feel a nice stretchy quality here as opposed to just a gripping and restriction. The reason I'm making this video now is that for me, that's a really nice metaphor for both why, in the end, I needed to get a hip replacement. In other words, sometimes things get to the point where you just can't improve them enough with manual therapy, physical therapy, exercise therapy, etc. There's that. But also, it speaks to why we do these kinds of interventions with the body. Specifically, in my case, manual therapy, structural integration work. So we feel it here, but the issue is actually here. So what Ida Rolf said about that is it hurts where it ain't. And so the pain and dysfunction was here, but the actual issue and restriction was here. So that's why sometimes it really helps to check in with a skilled practitioner. Anyway, hope that was helpful. Bye-bye.